Hey, if you're someone that wakes up with low back pain pretty much every morning, that makes it really tough to get your day started, really tough to get out of bed, the three most common reasons for that are discogenic pain, muscle pain, and then finally ankylosing spondylitis. So let's go over discogenic pain first. It's the most common. So discogenic pain is when the intervertebral disc is not functioning quite properly. And what happens is we'll normally have patients who wake up in the morning. For the first 20 minutes, they'll experience some real tightness, some real soreness, some real pain in that low back area that doesn't go away until they get moving for about 20 minutes. This pain can be sharp in nature. It's usually achy though, dull. Sometimes it has some radiating pain down the leg. And when you have discogenic pain, really what's causing it most of the time is forward flexion. So either sleeping in that forward flex position, or whether it's doing all the activities that you do in the morning in that forward flex position, such as brushing your teeth over the sink or whatever it might be. With discogenic pain, the best thing that you can do for it is exercises that are taught by a trained professional, someone who's really trained in spine care. They can really help you out with discogenic pain. It is the most common type of low back pain, so if you're experiencing it, don't be too worried. It is something that you can work on. Number two is muscular pain. So muscular pain, again, pretty common. This one's going to be something where maybe you're working out the day before and you just wake up the next day feeling stiff, achy, a little bit painful. And when you have this, it's generally going to last probably 5 to 10 minutes. It's going to go by a lot quicker than the other two types of pain that we're going to talk about. And so with muscular pain, generally you're just going to wake up a little bit stiffer, feel a little bit tighter in that low back. And so the best thing for this is really stretches and exercises. If it's something that you're consistently experiencing, maybe after every workout, then it's something that you want to talk to a specialist about, a low back pain specialist. And then finally, we have ankylosing spondylitis. So ankylosing spondylitis is the least common one of these. And with ankylosing spondylitis, it's also the one that needs the most medical intervention most of the time. So ankylosing spondylitis is an inflammatory joint condition, most commonly of the SI joint, the sacroiliac joint, and also of the low back. And when you have ankylosing spondylitis, you'll often wake up with low back pain that's pretty intense in nature. And this low back pain will take 45 minutes, an hour, generally greater than a half hour for it to start to decrease. And then after that half hour, 45 minutes, an hour, it does slowly decrease, but you still feel it through most of your day. It's going to be a stiffness, it's going to be a tightness, it's going to be a lack of mobility, things like that. And when you suspect that you have ankylosing spondylitis, again, going to a spine care specialist is going to be a good first person to go to. And generally what they're going to do is send you to a rheumatologist. Rheumatologist is going to be better able to treat that condition. There are some conservative measures that you can take with ankylosing spondylitis that can help with the treatment, but generally medications are going to be the most effective form of treatment. So if you have any of those types of low back pain, if you're waking up with low back pain, please visit a low back pain specialist so you can get it figured out.